Tomorrow marks the 35th birthday of a Mendon, Illinois man who died while on Kratom. His family reached out to us after our Spotlight on America report last month, which highlighted the danger and push to regulate that drug. Hayden Donaldson shows you how the family is hoping to prevent more deaths.
Okay, so this picture of him and his family.
There's this one too, Mom. I mean, I wouldn't stress about it too hard.
Chad White was described by his family as the best father and person you could ever dream of.
He was just the nicest guy. He was popular, but he didn't let that affect it. You know, he was nice to anybody and everybody. He had friends wherever he went. Chad made friends. He was the best son. I couldn't have asked for a better son.
Lisa Gardner and her husband Mike were out eating in Quincy last August when they received a call that no parent ever wants to receive.
I immediately went in to the girls. His daughters was there. He had started having a seizure and collapsed about 6 feet away from them.
Chad had passed away at the age of 34 due to a buildup of the drug kratom in his system. Kratom is a drug that is derived from a tree in Southeast Asia and is used for its stimulant for things such as chronic pain, as well as self-treatment for opioid withdrawal. The drug has become a hot topic for regulation around the country, including here in Illinois, due to its dangerous effects.
Pharmacotherapeutic products that affect the mu receptor in the brain and have a certain shape are defined as opiates because they affect the opiate receptor in the central nervous system in the brain.
Chad had been taking the drug for anxiety as well as maintenance for his addiction that he had been sober from for 10 years.
He just kind of started taking this as a supplement, and he thought it was safe. He really did. He thought it was natural and safe and kind of vicey, which he was kind of concerned about.
According to the coroner's report, Chad's death was due to metragenine intoxication, the main active compound in kratom. His family says now they want families here locally to know about the effects of the drug.
Going back to its core, where it's from and everything, I think that is kind of what people are thinking that they can base their information off of, and it's not accurate. By the time it's shipped and reaches the U.S. and reaches the shelves, it's dirty and unregulated. And that's the fact of the matter.
Tiffany White is Chad's sister as well as a registered nurse and says there has been no concern about it from any of her peers in the medical field. She says with the loss of her brother, she hopes to bring more awareness and regulation to the drug.
I know a lot more kids, even really young kids, take it, and adults, and will really back it thinking it's a lifesaver, and it's not. I mean, I just really hope that this gets to those people before it's too late.
I'm Hayden Donaldson reporting.